We did a secondary analysis from the Paradigm trial. As you know, Paradigm was a study of 8,400 patients with heart failure and reduced ejection fraction, comparing the new angiotensin receptor neprilysin inhibitor sacubitril/valsartan with enalapril, the gold standard of care for heart failure therapy. And we found that overall there was a 20% reduction in cardiovascular death or heart failure hospitalization, 21% reduction in heart failure hospitalizations, and a 16% reduction in mortality. We did the secondary analysis to look at what happens to people who left the hospital after an admission, were discharged, and whether they came back to the hospital within 30 days. As you know, in the United States in particular, 30-day rehospitalization is an important metric, and hospitals are actually at financial risk if patients come back to the hospital within 30 days of a heart failure hospitalization. So we looked at patients who were admitted to the hospital and then were discharged, and we found that there was a 36% very significant reduction in the number of patients who came back within 30 days with any hospitalization at all after a heart failure hospitalization if they were in the sacubitril/valsartan arm. And if we look at heart failure hospitalizations subsequent to a discharge, we found this was even more impressive, a 44% reduction. So this suggests that not only does sacubitril/valsartan make it less likely that a patient will be admitted the first time to a hospital, but if they get admitted, they're less likely to be readmitted within 30 days. And this is reducing the burden to the patient and also reducing the burden to the healthcare system and the potential financial risk to the hospitals. We believe that in patients who are similar to those that we enrolled in the Paradigm study, heart failure with reduced ejection fraction, class 2 to 4, that these patients would benefit from being on sacubitril/valsartan in comparison with an ACE inhibitor or an ARB. This drug was extremely well tolerated. We actually had overall fewer side effects on sacubitril/valsartan than on enalapril. We had less hyperkalemia, we had less renal dysfunction, we had a little bit more symptomatic hypotension, but no more patients came off the study medication because of symptomatic hypotension. Well, the Paradigm study was presented just over a year ago at the ESC. The drug, now called Entresto, was approved by the FDA in early July, so physicians are just starting to use it. We're just starting to get a sense of what it's like in our own hands. I think that since the goals of treatment of heart failure are to keep patients living longer, we know that we reduce mortality. We know that the goals of treating heart failure are to keep patients out of the hospital. This will keep patients out of the hospital the first time and also subsequent hospitalizations and within 30 days. And we also, and will be presented at this meeting also, we've shown that treatment with sacubitril/valsartan is associated with an improvement in quality of life. I think that this drug is now approved by the FDA, so it's available for people to use as they see fit within the indications of the label. We're also testing this therapy in patients with heart failure with preserved ejection fraction in an ongoing trial called Paragon.